Thank you, Julie. Okay. All right. And so, Michelle, I'm going to hand it over to you and Dr. Mercuria. Whenever you're ready, I think you'll be able to share your screen and people will just keep coming on as you're talking, okay? Thank you
Okay.
so much for being here with us.
Oh, thank you. Thank you for the invite. And let me share this. And can you see the first screen with the title?
Beautiful.
Oh, great. So, hello, everybody. Good afternoon. My name is Michelle DiMaggio. In pre-COVID life, I was a supervisor with Contra Costa Environmental Health. Now in COVID life, I am a supervisor for the Locations Investigation Team. With me today, I do have Dr. Stefanet Mercuria. She's going to be helping me, especially with the medical stuff, so since I am not a medical person, and also Reagan Rywards, who's going to help me on the chat. We're going to try to answer as many questions as we can within the slides. Our time is short, so what I'll do is all the questions that we have not been able to answer, I will reply in an email back to Margaret and give you as much information as possible. And I hear an echo. My apologies.
Hey guys, I'm a decision. Situation. I'm a business.
Sorry, I heard an echo back there. So our main goal is to help you. We're here to help you. We're here to get you through this COVID crisis, and we really want to guide you as best as possible if you have a COVID exposure at your site. So moving forward, I'll go ahead and basically with the objectives. So we're going to provide you an overview of COVID-19 through Dr. Mercuria. And then we're going to talk about our partnership, public health and child care providers, and specifically in public health locations, what are our roles and responsibilities? Also talking about the decision grid. So we have created a grid for different scenarios. Specifically, we have one for child care, and that will be provided to you. And then just our locations, investigations, and support. We'll go through some scenarios. I have placed a couple of questions within the slides, and then next steps. Oops. So Dr. Mercuria, you are on.
Hey everyone, thanks Michelle for the introduction. As we're talking about the novel coronavirus, also called COVID-19, is a family of coronaviruses is a family of viruses that cause respiratory illness, and some of them cause the common cold, and they also include other things like SARS, which we heard about mostly in Southeast Asia, MERS, and we've seen a few cases in the Middle East, and strains that also cause, as I mentioned, the common cold. The novel coronavirus, also called SARS-2, or COVID-19, is thought to mostly be spread by droplet spread and heavy droplet. We don't really know much about immunity with past exposures, and we're learning more and more about immunity as time goes on. So currently everyone is susceptible. The vaccine is in progress, and CDC anticipates wide release in 2021. Next slide.
It's moving pretty slow, so give me 1 minute.
No problem.
For some reason, it's not going. Oh, there you go.
So COVID-19 symptoms, people develop symptoms anywhere from 2 to 14 days after exposure. And the symptoms can range. There's a wide list of symptoms currently, and so fever, chills, cough, shortness of breath or difficulty breathing, fatigue, muscles or body aches, headaches, loss of new loss of taste or smell, runny nose, vomiting, diarrhea. And children often have milder disease. Sometimes there also has been associated rash at times, and it can be very mild in children, and adults may have more severe disease, so it might seem like a little bit of a mild cold in some kids. Next. As I mentioned before, COVID-19 transmission is primarily thought to be person to person, so respiratory droplets. In person, and that essentially means if you're close enough to an individual and a droplet can go the distance, then you may or may not get exposed if they're not wearing a mask. And the person is thought to be or known to be infectious starting 2 days from their symptom onset, and then until they're cleared of the infection. So that's 10 days after symptom onset or 10 days after a test date if they're asymptomatic and they had no symptoms. There's been some research around potentially if it's airborne transmission, and they thought COVID-19, the current thought is it's primarily respiratory droplets, but there might be opportunistic airborne transmission. So in a smaller space with individuals, so outdoor activities are more less likely for kind of the airborne transmission, not ventilated while people are screaming or yelling, things like that. Next slide. Isolation is the recommended time people who are ill must stay away from other people. So isolation is for ill people, so people with the disease. And it may last longer than 10 days, but the minimum is 10 days from their symptom onset, and if their symptom resolved, or until their symptoms resolved, or 10 days from test collection date. If they're still having fever at the 10-day mark and their symptoms haven't improved anymore, so it's not really resolution for all symptoms, it's actually improvement, and then fever resolution and nausea or diarrhea and vomiting, you want it to be resolved. And you'd want the fever to be resolved for at least 24 hours. So some people may have fever for longer than 10 days, so they need to be 24 hours fever free. As I mentioned, symptoms may last longer, and some symptoms don't fully, for some individuals, most kids resolve fully, but for some individuals, and we see more in the older adults, that they may have prolonged symptoms, but they're no longer contagious, so as long as their symptoms have improved. Always have staff and children check their healthcare provider and coordinate return to work or return to the childcare accordingly, so to make sure that they check in back with their doctor. Next. So quarantine is for people who are exposed, who are not ill, and it's recommended that people who have exposure to a direct COVID positive case, that they stay away from others from 14 days from their last exposure. And that's because they may become sick during their incubation period, which is 14 days. So day of last exposure plus 14 days. And on average, most people who convert between between the 5th and 6th, 8th day. But there is that spectrum that anyone can become infectious or become infected with COVID-19 from 1 to 14 days after their exposure. So and that is why even if an individual were to test within that quarantine period and have a negative test, it doesn't mean they can come out of quarantine early. They still need to complete the full 14 days. So what is considered a close contact? CDC refined their definition just this last week. And so someone is a close contact who's within 6 feet of an infected person for a cumulative total. So that's the change. They just generally were saying 15 minutes or longer. But now from a cumulative total of 15 minutes and 24-hour period. So it could be moments. So it could be over 1 day, small 2-minute exposures to someone from the time they're infectious. Again, that's 2 days from the symptom onset or until they're cleared of their infection. Next. This is just a good example of how to calculate quarantine. And so you see it's circled in red, the Wednesday, is the last contact with a person who had COVID-19. And then quarantine starts on, so that's day 0, and day 1 starts on the Thursday. So 14 days of quarantine, and the last day is the 15th, if you kind of count it out. All right, next slide. Some preventative, so what we do know as we're learning a lot about COVID-19, we do know the preventive measures have helped and are the most beneficial in kind of controlling the spread, which is masking or facial covering, social distancing, good hand hygiene, and staying home when you're sick. Next one.
Thank you, Dr. Mercuria.
Sure.
I didn't mention that Dr. Mercuria is our Health Services Deputy Health Officer. So she pretty much heads our team. And anytime we have a question regarding clinical or what's new, Dr. Mercuria leads us on that. So thank you for that. So moving forward, we do have a lot of information for you and documents as well, and we'll provide that. But what is a cohort in a child care? So pretty much it's defined as a combination of no more than 14 total children and supervising adults in a supervised environment. What is a supervised environment? Basically, you're controlling that environment. So they want to stay together in all activities, meals, recreation. And the biggest thing is to avoid contact with any other cohort. Mixing of cohort is just a big no-no in this particular case because you want to prevent exposure. The biggest thing for practicing a cohort structure is to make sure to, one, decrease the opportunities for exposure. That is the most important here in transmission of the virus. As you heard from Dr. Mercuria, it could aerosol, and there is a lot of potential for, especially with a high virus count, that it could pass to other people. Also, cohort structures, it helps with efficient contact tracing, just in case there is a positive case. So we'll talk about contact tracing in a minute. It just basically, it's easier when you have one group. The reporting is so much more efficient, easier for you to be able to report cases and who has been a close contact. And also allows for targeted testing of that one particular cohort, quarantine and isolation of a group instead of multiple populations, multiple cohorts, kids, and supervising. It becomes a lot more complicated when there is a mix. So case investigation and contact tracing partnership, we are here to work with you. We are truly here to help you find out possibly how there was an exposure, but also to find out who has been exposed. So on the right-hand side, how does contact tracing work? I will include this as part of our handouts for you, but we will provide you guidance materials when there is a COVID case identified at your child care facility. It will be directed to the locations investigation team, which is us. We have a few case investigators. And there should be one point of contact on your particular side. So if you haven't already provided a name or have a name on your records of who will be the contact for public health, it's really good to have one as soon as possible. And one of the handouts will be a decision-making grid that was produced, as I mentioned earlier, specifically for childcare. It has resources on there, and also it has particular scenarios that we'll get into in a little bit. We are all working to get through this entire process, and we're trying to make sure that you stay safe, and that we just want to know that we are here for you. So as a request, Contra Costa Health Services, as I mentioned, does request to designate an administrator or staff member as a liaison to communicate between your staff and our public health department, specifically the locations team. That your role is to collect, communicate, and coordinate, and we'll get into each one specifically. So when we say collect, when there is a case, we ask that you collect information on all employees and children who may have been exposed, so a cohort. So if you have an exposure in one particular cohort, we ask for those names, and we'll send you a roster. On that roster, it'll ask for the employee or the child's information, like the date of birth, their address. So one particular reason is because we will look up that information. We look it up in what's called CalReady, which is a state system, and CalConnect. And we make a record and we attach it to what's called an exposure event. So it's always in our state system. The shifts for employees. So if there is a cohort in the morning, then a cohort in the afternoon, for example. And the cohort in the classroom of the child. For example, if it's classroom 3, if that would help a lot, especially if we have to go on site, we know where classroom 3 is. And the site of employment. So if it's not a teacher and it's somebody who works in the office, that would be really great if you can point out that they, for example, are in the kitchen, or if they're receiving documents, or if they're help screening. Again, you can refer to the decision-making grid when trying to decide how to fill out this roster. Collaboration is so important. We are a partnership here. When there are multiple positives in a child care facility, we just know that we do not share your information. We are held by HIPAA. So everything that you let us know, it all stays within our system, within our group. Consequently, if there are 3 or more cases within a cohort or multiple cohorts, we do consider that an outbreak. And that is 3 or more cases or exposures within a 14-day period. Now, as of January 1st, 2021, there was a new law, Assembly Bill 685, that requires reporting to the local health department for outbreaks at your site. And I can attach that as well. Again, if this happens, don't worry. We're going to help you get through this process. Usually my team, myself or my team, will go on site. We'll conduct what's called a site assessment. And what I do is I look around, or my team looks around to see, okay, what control measures are in place, what control measures are not in place, what personal protective equipment or PPEs are available. Is there social distancing occurring? For example, how far are the beds placed? How are the groups separated? So we take a look at that, and then we give you recommendations on how to improve your COVID mitigations. And we give you a plan, basically. And we also maintain regular contact. We ask that you maintain regular contact with our group. For example, if you hear that there are more cases, or if a parent, for example, has COVID and their child is attending your school, just keep in contact with us, because we are here to guide you. That's our main goal. As we mentioned, communication is very important. Maintaining clear lines of communication with your employees and parents, or anybody who is in close contact with the positive case. There is no reporting responsibility to the general public, meaning you do not have to place this on Facebook to let people know, or a newspaper. It is within your purview to keep the information within yourselves and the parents, and also by letting us know at locations that there is a case. There is a mandate, however, to notify your employees. There is another bill, I believe it's 1159, Senate Bill 1159, which I'll provide you, that requires that you do inform your employees when there is a COVID case within your cohort. And you can do that by posting a notice, you can text them, you can email them. And what I'll do is I'll highlight the section that very clearly states what you need to do to notify employees. And that is as of, I believe it was September, as of September. Just know and be certain that our team will not notify the general public of your information. If anybody requests it, they have to go through a Public Records Act, which will go to our PIO, and also will maybe going to our upper management for approval, but it's a long, lengthy process. So we talked about the grid earlier. We're going to say, go to the grid, go to the grid. This grid was created basically for multiple scenarios. What do you do? How do you respond? Do you notify health services or not notify health services? Also in there, we have what's called a intake form. On our website, under schools and childcare, this will be on there. And you can basically click on the intake form and fill out the information when you're reporting a case. You can also, on the right-hand side, go to our email, which is covid.business.tracing@cchealth.org. I usually answer that, or one of the subject matter experts will answer that email, and we will assign, our SMEs will assign the case. If there's a question, myself or one of the SMEs will call or email you as soon as we can to try to answer your question as best as possible. And specifically mentioned here, when you have a positive COVID-19, must isolate at home, as what Dr. Mercuria talked about, and notify the locations team. You can do that again by the email or by the intake form on our website. Okay, so now let's get to the scenario, and I'm going to ask that Dr. Mercuria and Reagan Rywards if they can join me on these questions. But basically, let's go to scenario number 1. We have a staff or a child with COVID-19 symptoms. What is your actions? Basically, it's the symptoms. We're not sure exactly what it is. So send home, and it is especially important to advise to consult with the primary care provider. As somebody mentioned, the cold's coming up, flu's coming up. Consulting with your primary care provider is very important. We do recommend testing just in case they do have all the symptoms of COVID. You want to make sure that they test. And it's better to test at least 5 to 10 days after the symptoms have started so that you get a nice, clear positive. Monitor children if staff is a teacher or aide. So if one of the teachers or aide has symptoms, it's very important to monitor the children to make sure that they don't have the symptoms as well. And your classroom or your cohort may remain open. For communication, no action is needed. Scenario number 2. Staff or child tests negative for COVID-19 after experiencing symptoms. So now that they have symptoms, but they went to go get a test, now what do you do? So your action would be, may return to school 24 hours after symptoms have resolved, as Dr. Mercuria mentioned earlier, and classroom may remain open. But you do want to consider for communication that you may notify your school community just in case for awareness to obtain testing. Contra Costa Health Services does provide free testing throughout the county. I will send a flyer to that, but you can also go onto our website, coronavirus.cchealth.org, and I'll send that to you as well. Scenario number 3, COVID-19 positive case at your child care. Consequently, if you have a case, that's when notification to our team, the local public health, with the locations investigation team is important so we can start the process. You can go on to the decision-making grid, and on there is the intake form, or as I mentioned, you can email us at covid.business.tracing@cchealth.org. Isolate the case and exclude from the cohort for at least 10 days from the symptom onset or from the test date. And you can use that calendar that we showed earlier, or a calendar, and go back 10 days or go back from the test date. Identify who was with that COVID positive case. Who was within 6 feet, 15 minutes at least within the 24-hour period, as CDC had mentioned. Quarantine and exclude exposed contacts. As Dr. Mercuria mentioned, the 14-day quarantine period. And you're most likely going to have to quarantine and exclude the entire cohort for 14 days after the last date of the case was present at the site, at the cohort or classroom. And it's especially important to make sure that you clean and disinfect, not just disinfect, but clean and disinfect all primary spaces where the cohort in the case spent significant time. Usually, in this last classroom that I saw, it's going to be the whole classroom, from when you enter the door to the cubby holes that they have, to your hand wash sinks, to your restrooms, to the play area, to the desks, everywhere where people are placing their hands, where the kids are placing their hands. You want to make sure that you clean and disinfect. And I'll include a handout so you can have this information as well. Notification of a known court case. We do have a letter, if you like, that the schools use that you can send to exposed and non-exposed parents or other teachers, and we can make that available to you as well. COVID scenario number 4, staff or child is close contact with a confirmed COVID-19 case. So they were with somebody within that 6 feet for 15 minutes to a person that was a COVID-19 case, for example, their parent. And I've heard many cases of this. So again, sorry about the double send home here, but send home, and advise to consult with the primary caregiver. We want to make sure that staff or child do not have COVID or do not obtain coronavirus from the person that they're with. Quarantine for 14 days from the last exposure. That was the last time that they were with that particular person. And again, recommend testing. However, even if they get the test, it will not shorten that 14-day quarantine period. And again, classroom cohort may remain open. Communication, again, it's at your discretion, keeping in mind the AB 1159, how to communicate when there's a case at your site. Okay, scenario number 5, staff or child is a household member of someone who is quarantined. So someone is a close contact in their home, and that child is in that home, or the staff is in their home. So basically they're a contact of a contact, or a contact of a contact of a contact. No action needed. Staff and students should be encouraged to monitor their symptoms, as Dr. McCurry mentioned earlier. If quarantine and household member becomes symptomatic, staff or students should also be quarantined. So if their household member starts, for example, the fever and the chills and every symptom or some symptoms, then they should also be considered quarantined. Siblings in this case should also be interviewed in quarantine. I knew in some cases we had siblings in one cohort and then 2 others in another cohort. So that's something to consider, because now you have possibility of exposure in more than one cohort. Okay, and again, Dr. McCurry and Reagan, anytime you want to come in, we now are going to be going to some of the questions that you had asked us. So Sophie, I'm going to especially ask some help on this one. So when can staff and children return? And Sophie, do you want to take this one?
Sure. So currently there's no real recommendations for quarantine after travel, and particularly when there's high prevalence in the community. Traveling to other places doesn't necessarily change your risk. There is some places like we may have higher risks within airports if people can't socially distance appropriately or don't take precautions, so potentially have higher risk within those settings. But there is no recommendations for quarantine after travel, or even currently, or even testing. Of course, we do want individuals to monitor for their symptoms, and also and then if they'd have any known contact or exposures while traveling, that would be kind of different.
Thank you. The next question we had is, which symptoms should keep a child out of childcare and for how long? Again, believe me, this decision-making grid is going to be very helpful for you. You're going to see the different scenarios and how to respond and what action you should take. But it's also, as Dr. McCurry mentioned, in the beginning of this presentation, it's important to follow up with the provider, for your medical provider, for guidance, and especially for the time period. Generally, if a child has a fever, nausea, vomiting, and/or diarrhea, public health, our team requests that children be symptom-free for at least 24 hours, but otherwise with improving symptoms before returning to child care. And then COVID reporting of Contra Costa County employees. So this teacher, for example, lives out of Contra Costa County but works within Contra Costa County. And we've had a couple of cases of this. So the lab results for that person, if they live outside of the county, will go to that county of residence. For example, if they live in Alameda County, the results will go to Alameda County Public Health. Therefore, our team, Contra Costa County, will have to coordinate with this county in order to conduct a case contact investigation. Also, if the teacher staff reside outside of the county and if they're positive, we ask that you let us know so we can also coordinate with that particular county because the workplace is within Contra Costa County. Closure considerations. I know in working with the different daycare, some have taken upon themselves to close the daycare because of the exposures. But for us, we look at multiple things when we start considering and providing guidance for you to close. It depends on the number of ongoing cases, how many cohorts have been affected. For example, are there different classrooms that have cases, or is it just one classroom? What's the potential for exposure? And the percentage of staff of children that have that are positive for COVID-19. So we'll determine that. We'll ask you, for example, how many staff do you have? How many children in each cohort? We'll also consult with our local health officer, who is Dr. Mercuria, and we'll ask, okay, so we have this many cases, this many classrooms. What is the consideration? What guidance should we provide? And we will also, as I mentioned earlier, help you with mitigation measures. So we will conduct a site assessment as much as possible to look at what's going on the site. And we can help you by either creating a mitigation plan or looking at your current plan and how can we guide you to improve that to prevent further exposures or increased exposures. And again, the most important measures you can take are obviously maintaining the mask coverings, social distancing of the cohorts themselves, hand hygiene. I don't have kids, so it was really cool when I went to on site for the childcare, and I'm a short person, and these hand sinks were perfect for my size. So, and then stay home when they're sick. So again, consulting with their child, or if they're sick or family is sick, it's probably best to recommend for them to stay home. And finally, our info and guidance, which will be sent to you. I mentioned our email, covid.business.tracing@cchealth.org. If you don't have that email, you can always call our intake number, which is 925-313-6740, and your call will be emailed to the business tracing email. For testing, this is the website, but I will send a link to that. So if anybody wants to get COVID tested, you can make an appointment to our multiple sites within Contra Costa County, again, that provide free testing. And you can report a case via our intake form. And the form is within that guidance and also on our website. And Dr. Mercuria, any last words? Or Reagan, any last words?
No, nothing to add.
And again, please know that Contra Costa Health Services Location Investigation Team is here to help you. We are here to provide as best guidance as we can to not only prevent exposures at your place, but help to control exposures. And thank you. Thank you for having us.
So Michelle, we're not ready to let you and Dr. Mercuria
Yep.
go yet,
Yep.
because I want to say there's 160 people on this call. Someone has got to be having questions. I know we have questions. You know these words, you know the lingo, but to me it was fast.
Oh.
So I'm going to slow you down. And they couldn't see the grid, and you're saying go to the grid to look for the answer. I want if you could enlarge it, that would be great. I would like the plain old answer to when a child has a runny nose.
Mhm.
What are they supposed to do with a runny nose?
Dr. McCurry, you want to take this one?
Sure. Yeah, I think a runny nose is hard, and it's hard for the child care provider to know what that means. I mean, it is allergy season, it has been smoke,
Yes.
it's been a lot of things going on, but we also have seen COVID from just a runny nose, particularly in children. And so it's hard to say which way, and why we recommend that you have the child follow up with their healthcare provider, because maybe they have a long history of allergies, and the healthcare provider can give you some guidance and a note saying that they don't necessarily need testing or follow-up, or recommend testing and have them go get tested.
So are you saying for children to come back to school, if they have a runny nose, that they need a doctor's note?
I would say evaluation or follow up with their PCP, and whether that's testing or a doctor's note if they don't do testing.
So I hear sometimes it's very hard to get in to see the doctor. We have some children on Medi-Cal, and so they can't get in right away. And it's very hard for the working parents. I'm not trying to, it sounds like I'm trying to present a case here, but so the providers are trying to be as safe as possible for all the families, but they don't want to make things so difficult for families to be able to go to work. So they don't want to do overkill. That won't help. But if they can't get in for an appointment, the testing, sometimes I hear that they can't get tested unless you have symptoms. So are you saying sometimes if you've been exposed, so the parent comes to the child care and says, somebody at my work has tested positive, but that parent hasn't. Does that child, that parent, everybody have to stay home because the parent was possibly exposed?
No, I mean, the only one who would need to quarantine is the direct exposure of the parent. And actually, we do test asymptomatically. So we commonly test contacts and commonly have them tested even while in quarantine, just to see if they convert, because we have seen some cases of asymptomatic infection. So if they're a contact, we do actually recommend testing. And if they're negative, they would still need to continue their quarantine, but we do test asymptomatically all the time.
Okay. All right. I'm going to ask you some questions that are coming in while you've been talking. Let's see. And Kim and Julie, you could help me out too. I'll read the easier ones here. Do we have to worry about the germs coming in on backpacks or lunch pails that the children are carrying?
I can answer that. So basically, contact surfaces are not as high as aerosol. So you want to especially make sure that, one, that the parent understands that they need to launder any clothing or backpacks. And I would say often, even daily. What I have seen at this one particular daycare, and I'm sure it's probably done everywhere, is the cubicles for the children have their own cubicles, no mixing of cubicles, or even keeping the backpack in their own little container. I have seen this at one school that did a really good job, and they would keep the personal items that came with the child in a container. So that helped prevent with exposure as well.
Okay. How about middle school students? Is there more than one staff? If there's more than one staff member visiting the group, is this going to change for childcare staff as well?
Middle care, say that again.
Okay, let me try to read. How about middle school students? if there is more than one staff member visiting the group, is this going to change for childcare staff as well? I'm not quite sure. Maybe Pauline, if you want to write in more. Oh, wait, maybe I should go under there.
So it sounds like there is, from what I'm hearing, there's one staff member that is in middle care, but also goes to childcare. Is that correct?
Maybe the author of that question would like to. Kim or Julie, can you see if Pauline wants to unmute and talk to us?
Well, I see here that Paulina actually asked a second question, and it's, is our staff able to work in Group A that comes to school Monday and Group B that come Tuesday? Maybe that's more of a detailed question. So it sounds like she is wondering if teachers are able to mix basically in cohorts, and the answer should be no, right?
Correct. Yeah. Yes. Thank you. Yeah. Avoiding the biggest thing about cohorts is making sure not to mix. Sometimes when you have a mix, you have a higher potential for exposure to other students. So that'll be more close contacts that you'll have to look at.
Okay, you know, I think there's lots of questions coming in about allergies. If the parent knows that there's allergies, that their child has allergies, how can they handle that when they can't get in to see the doctor for a couple days and they're losing days of work while they're waiting?
I'll hand this one to you, Dr. McCurry, if you don't mind.
Yeah. Yeah, I think these are if they're new symptoms. I think if they have a history of allergies and they're improving on their like allergy medicine or treatments, then that is different than a new like runny nose or stuffy nose that a no history of allergies. So I think if the parent knows that they have a history of allergies and they see improvement with treatment or whatever they usually do, then that would be different than if it's new and need more follow-up as well.
Okay. So their program, she's saying their program has children stay home for 10 days if they can't get a doctor's note. Does that make sense, Dr. McCurry?
That is a conservative approach, especially when we're seeing higher prevalence. We are seeing decrease of prevalence, but when we see high prevalence in the community and when we didn't have testing capacity, that was one recommendation that was being said, that assume that any symptom is likely COVID and have individuals stay home for 10 days. When we have more, if they can't see the doctor, the better thing potentially would just get testing, because testing turnaround times are pretty fast these days.
Oh, is it? What are you hearing these days? How fast they can get their
from our test? So it depends on when you get testing done through, but from our testing sites, on average, they're between like 2 and 3 days, which is less than 10 days. So
okay.
And then they can always schedule testing at our sites without a doctor, and similar with Kaiser currently as well, if you have Kaiser. And so they can go online and schedule it on our cchealth.org website, and it's how to get tested, and it's just an easy scheduling.
Okay. How about if a child has diarrhea? Can they return 24-hour when they're 24 hours symptom free, or do they need a COVID test after they've had diarrhea?
So diarrhea we know is really common in children, and it also is a COVID test. It is also a COVID symptom, and so it's hard to again say that they don't completely not have COVID when they just have diarrhea. And so ideally, if they have symptoms, we would want them to get tested to rule out COVID. If they have like other causes or other reasons, or it seems like their whole family has, it is also acute it is AGE season as well, as we know, then they potentially may not need a COVID test and then just need to be diarrhea free for at least 24 hours. I will say norovirus has a slightly longer incubation period and is norovirus season. And so to be extra cautious that you don't want a different outbreak, you would want to keep them potentially out for even 48 hours if they have diarrhea and vomiting.
Okay. I want to go back to the travel question, because that's coming up a lot now with the holidays. And you're saying they do not have to have any policy. If a person is traveling, no matter what mode of travel they use, it has to be, you don't need to quarantine them at all unless they have some symptoms. So if they
Yeah.
fly on a plane.
There's no recommendation currently for quarantining. Flying on the plane is the potential to have slightly more exposures and a lot of people traveling in the holidays. So potentially you could do air travel versus car travel, but there is currently no recommendations for quarantining when traveling, just like generally speaking. But it isn't wrong if your child care wants to take in consideration traveling by plane or where they could have had very close quarters. It's harder to social distance versus car where it's very easy to stay away from people.
So Dr. McCurry, what do you think of if they go ahead? I know a number of programs do have a policy. If you're travel, and they tell the parents way in advance, if you're going to travel, you need to isolate for 14 days when you come back.
I don't think it's wrong to have a policy in place for traveling for your facility if that fits your facility needs. It just currently there's no current quarantine recommendations. And so if you feel like for your facility that having them quarantine to be extra precautious for 14 days after travel is appropriate and it works for your needs, then I think that's okay as well.
Okay. Kim and Julie, are you seeing some more questions?
I see one here. I kind of reformatted it. Basically, what are the guidelines for middle school and high school teachers who are moving from classroom to classroom?
Guidelines for middle school and high school? I don't know. So currently we still recommend cohorting in other schools. It might be slightly different in middle school and high school, but we still recommend as much as possible that middle schoolers and high school teachers cohort with the same cohorts.
I'm sorry.
Sorry, to add to that, there is a similar question in the chat, and it just says, please address the mixing that will begin to occur with schools coming on site. All of our cohorts will be mixed at that point. So I think people are starting to worry because as restrictions are being lifted more and kids are coming back more to school, there just needs some kind of guidance on how to keep the kids still safe and possibly in a cohort when more kids are on site.
And one of the guidance that I'll share with you basically says that the number of cohorts that can be safely established to avoid interactions between cohorts. So the important thing is for the need for distancing and separation of cohorts. I'll send a document of it's a FAQs that will help you with this decision between schools and childcare because there's a slight difference between the two.
Mm-hmm. And in terms of kind of when more people come on campus, part of the schools and what they have to consider is how to decrease like the chance of interactions, or a lot of people on campus, and potentially staggering schedules, staggering start times, which is something that could consider if you're sharing the campus with schools as well, as they potentially could be coming more people on site.
So how about if a teacher has to have the day off and you need a substitute teacher in there for the day? You have no choice. It's not the usual teacher, the usual person that's giving her break. It's not the director. It's got to be a whole new person coming in as a substitute.
I did actually have this conversation with one of the daycares, like almost exactly this. They had two teachers, but they're wondering if they can have a third one as rotation to come in. And the most important thing is if you do have the third teacher, just to make sure to stay within the cohort number. But also the difficult thing is if you're having this third person come in, I know this is going to be hard, but you really have to try to avoid them interacting with multiple cohorts because that's increased potential for spread. The way we talked to this one person is maybe having that third person, if they're an office person or if they do other things besides going to multiple cohorts. Reagan or Dr. McCurry, do you have any other input?
No, I think that's completely appropriate, right, Michelle? Obviously we just have to think of ways that we can still support the cohort if the normal cohort lead isn't there as well.
And then I just wanted to say one thing. This is Reagan. Thank you so much, Michelle. Sorry, I've been having a lot of computer issues today.
That's
Thank
okay.
you, Dr. Mercuria. And I'm trying to answer the questions in the chat. I did put the link to the grid. I don't have the exact link. I can't find it on our website, the actual childcare grid. I was only able to find the schools grid.
Okay, I'll add that.
So I just asked Michelle if you would just link that into the chat.
Sure.
And then one thing I just wanted to share in regards to childcare when a parent tests positive, really urge the parents to test the children, because what's going to happen is those parents are going to isolate for 10 days and the kids are going to have to then quarantine for another 14. So if they indeed tests right after the parent test, that will shorten that time period if they also test positive. So I know that that becomes a big issue. So that's a good recommendation when a parent at home tests positive and they have kids that you're sending home from childcare because they have to quarantine. Just really urge testing, because they'll be very upset when they're finished isolating and then they have to have their kids home for another 14 days because they were exposed that last day on their 10th day of isolation.
Okay. Someone's asking, can you please share again the close contact, the new definition?
Sure. Going there now. And what I'll do is I'll send that grid via email.
Oh, that's right. We will be sharing everything that Michelle's sharing with us today with all the people that have signed up for this.
Yeah,
And
as
then-
she's going, do you want me to say it, Michelle? I can.
Please, yeah, great.
So close contact is defined as someone who's within 6 feet of an infected person for a cumulative of 15 minutes or more over a 24-hour period. And that's starting from while they're infectious again, so 2 days from their symptom onset until they're cleared of their infection, so 10-day minimum from their symptom onset. And then the 15-minute cumulative is the new one. So it used to just be for 15 minutes, and so cumulative through the day.
Okay, I will open next Monday. I have a child who will come here daily, but will go to other daycare when our facility is closed. Should I have them stay home for a few days or not? They are not going to other cohorts. So when you're about to go from one cohort to another, because do they need time in between?
I think so, as long as there was no concerns for the exposure in the cohort or no concerns for positives in the cohort, they don't necessarily need time in between.
Okay. Thank you.
Mhm.
And how about a cooperative preschool, which is where parents come in and work at different times with the children? Can they go from classroom to classroom, certain day, rotating basis, every Monday and this parent's in, every Tuesday this parent's in?
Are the parents, so to clarify for myself, are the parents going to class A one week and then class B another week, but not going back to class A? Or
No, they're going to stay in class A, but a different parent comes in on Tuesday, a different parent comes in on Wednesday. I think that's what, I don't know, different co-ops may be different, but I think that's what Sarah means in this question, unless you want to tell me different, Sarah. So if it is a different parent, a certain parent comes in on Mondays, another parent comes in on Tuesdays, but it's the same group.
Okay, so each day probably has a new parent?
Yes.
Okay, as long as you stay within that cohort number and they're
Okay,
not
it's
mixing.
within the 16
Yeah.
or whatever's appropriate for the age.
And if they're not going to other cohorts.
Okay, thank you.
Sure.
And we have a separate schools grid, and that's more focused on K through 12. And I did share the schools grid in the question and answers.
Thank you, Reagan.
Absolutely.
When the children and the teachers are wearing masks, is that considered close contact? Where is that in the close contact definition?
It doesn't matter if they're wearing masks, so they're still considered close contacts.
Okay. When you isolate, can you go to work and be in an office by yourself? Is that considered isolating?
No, isolation would be remaining home. And if you live alone, then, you know, within your apartment, but if you live with others, even isolating away from others as well. So not leaving your
Wow, Dr. Mercurio, you're making it tough on me. I thought if I traveled, but you're saying there's no travel restrictions. I'm thinking if I traveled and then I came back, if I make sure I'm not, you know, closer than 6 feet to people, if I'm always with a mask on, I thought that was isolation.
Quarantine, so your isolation is if you're sick. So if you have
Oh, thank you.
Isolation, and then quarantine is if you're exposed. And so, I mean, when you come back from travel, I would say if you aren't doing a more conservative approach of doing a quarantine, you still want to make sure that people are monitoring, doing social distance, doing appropriate preventive measures, and being careful. If they are a direct exposure or direct contact, we do want them to quarantine at home. Potentially because they have a higher likelihood of converting to infection. Even when they're asymptomatic, they could be infectious. And so then they were, you know, out and about and potentially exposing people. So yeah, quarantining from a direct exposure, quarantine at home, and still similarly try to stay away from people in the house as much as possible, wear masks inside. And so if an individual is traveling, there's no recommendations for quarantine from travel, but more high precautions and preventative measures is also warranted and appropriate if individuals come back.
Ooh, this is tough on parents.
Yeah.
We currently have no parents allowed on campus. Is this a policy that should continue?
That's up to you. I have seen where the parents will go up to the door, but no further, which seemed to work well. Because it was a gate entry, or they'll go up to one place at a table at entry where the parents would just drop off the child. Winter's coming, so that's going to even be more difficult. But that actually is up to you on how far you want the parents to come in. But inside the classroom, there's no really guidance on that, but that's more exposure.
Michelle, are you working with California licensing that oversees childcare? Sometimes it seems like some of your guidance may be different than theirs.
No, we have actually a different guidance. We use the CDPH, CDC, the COVID-19 guidance, state guidance and CDC guidance, as well as our own Contra Costa Health Services guidance. We haven't really worked with licensing. I know they do have their different requirements.
That's true. And usually what we hear from licensing is here's their guidance unless our county tells us more restrictive.
Exactly.
So to go with the most restrictive is very safe, but a bit of a problem sometimes when you're trying to stay in business.
Yeah, and if you see something like that, feel free to send it to us. Because we can always talk to Dr. Mercuria and others in our group to say, okay, this is what a licensing is saying, this is what we're saying. How can we help you further, or is there a way we can help you?
Okay, this is a new one. You have a floater assigned to a specific cohort to give breaks, every 10-minute break. If they're outside, you know, if the breaks come for that teacher while the children are outside, is that a safer, acceptable solution?
I'll either if Dr. McCurry or Reagan want to jump in, but outside is better. If it's just is it for the recess or break time, or when they're out in the play yard? Is that what you're saying?
Yes.
Okay. I'm thinking for exposure, the exposure is less, and then Dr. McCurry, please correct me if I'm wrong, but the exposure is less. From the play yards I've seen, there's a great separation. I think most of them have some sort of fence separation, but especially maintaining that distance. And I'm thinking there's less exposure. Dr. McCurry or Reagan, you want to add to that?
I apologize, I missed the first part. Maybe Reagan has something to add first.
Oh, no, I think I totally agree with you outside, and then they're able to continue to maintain the social distancing of the 6 feet. I think that's the best prevention.
Yeah, is this for,
Just outside when they have a break, like if someone comes to give someone a break outside.
Yeah, while they're like in the play yard or
oh yeah, definitely outdoor. Anything that can be done outdoor has less chance of exposure, and so it's more recommended if you can do outdoor things than that.
Okay, and so then it doesn't have, then you could have a little bit more freedom. If you knew the staffing problems that childcare is having right now, they're lucky if they could find a substitute. So to
Yeah.
find the same substitute every day is an even bigger challenge. So a difference is if you're going to be having to use different substitutes, at least do it outside, break time,
Yeah,
Yes.
whatever.
yeah. If you're able to do it outside, and of course the same kind of as Reagan and Michelle mentioned, the same preventative measures such as social distancing, but outdoors would be safer and less exposure potential.
Let's see what other questions. Some of them are very specific questions, and we could try to get answers. There's many questions in the question and answer. I'm just reading off some of the easier ones. Are children over 2 still required to wear a mask in childcare if they're with the same cohort every day?
We recommend that they wear masks always. That's the best prevention.
Okay.
Thank you. I lost myself there. My internet's going in and out.
You know, if the kids are going to different activities, they're going to soccer, they're going to different groups, do the programs need to have policies about that? You only go to your house and to my childcare, and that's it. Or you can also be going to a soccer game, or you could be, practice. Actually, sometimes I'm feeling safer when things are outside. Is that a false safety?
No, things are safer when they're outside, but there's always the chance that if people are not, remaining socially distant and doing other preventative measures, that there's always a chance of exposure, even if outside. We just know because it's not a small room confined, the ventilation's very, open, that it's less chance of exposure. So when things are recommended, they are recommended outdoor first, particularly for group sport activities.
Okay.
I don't think it. I mean, people are going to continue to do what they're doing in terms of other activities as things open up more. And I don't necessarily think for the childcare that they need to track families and what they're doing in terms of outside of that. But we're trying to limit exposures when within the setting that you're in. So that's why we want cohorts that are the same. That's why we want, so we understand if there were an exposure, we can limit to this cohort, or we can try to protect the rest of the cohorts and the staff within your childcare. And so I don't think you can really chase families around in terms of the other activities, especially as we're moving down tiers that will be opening. But how to think about how to do contact tracing, how to protect while they're there, and how to minimize exposures within your setting.
And we can also give you a handout when it comes to youth sports. The most important thing is either they use the same equipment, but cleaning and sanitizing after use. And you'll see this in document after document. So we'll send you something on youth sports.
Okay, we will take and pass on anything you send us. Should they be writing about temperatures as the students are coming in the morning?
It's actually for documentation, it's up to you whether you'd like to, but not necessary.
Okay. Any recommendations for Halloween?
Don't eat too much candy.
Have you seen the elaborate things that people can try to do to give the candy away to the children that come to their home?
No, I haven't.
You got to go on Pinterest, Michelle. It's catapulted out from their door to the children at the sidewalk. They can put a PVC pipe and drop the individual packages down one at a time.
Oh my gosh.
Yeah, very clever things.
Well, they have the point, social distance.
Yes, yes.
That's the main thing for Halloween.
And so somebody's asking about parents coming to the door. You just try to keep everybody out as much as you can.
Yeah, our guidance, we do have something that our health officers have created specifically for Halloween.
Okay.
And I will supply that, but
Awesome.
basically they're saying try not to go door to door, social distancing, of course, masks. Because if you're going to home, now you're going to homes and you don't know whether that home, one knows that they're sick, but there's that potential for less than 6 feet.
So somebody's asking about sandboxes outside.
You had to go there.
Watching the sand. And also what we had heard at the beginning, we were more concerned about surfaces. And our centers are doing such a great job of cleaning surfaces so much. But if it's outside, do they still need to go outside and wipe down? So sometimes different groups are using the very same playground. So do they need to wipe down the climbing apparatus in between the groups that come out?
Yes. The virus will stay on the surface. Unlike other viruses where it'll kill upon UV exposure, this one won't. So it's important to sanitize in between use. So if cohort A is out in the yard and then cohort B is going to be 10 minutes later, you want to make sure that you spray down the surfaces. And the contact time is important. I know some of you that I've seen were using hydrogen peroxide disinfectant, which is really good. And that one dries very, very quickly. So look at your chemical that you're using and look at the amount of time it should sit before use. But yes, any contact surfaces do need to be cleaned and sanitized between use of cohorts.
Okay. Is there anybody that has a question that they would like to just ask themselves? Sometimes I know personally questions are too difficult to ask, to write out. If you can unmute yourself. Is that okay, Kim? Will they be able to do that, to verbally ask a question?
If they can raise their hand,
Okay.
I can move them to a panelist, I believe, and then they will be able to.
Okay, here's a nice easy one. If a parent has pink eye, does the child have to stay home? The parent has it.
Dr. Mercuria?
I mean, the pink eye is very contagious, as we know, but if the parent alone has a pink eye, then the child doesn't need to stay home unless the child should go home if they develop pink eye, they get signs and symptoms of pink eye. Similarly, the most important thing for pink eye generally is hand hygiene. And I know in children, it can be hard at times, particularly, but just monitor their symptoms from pink eye. But pink eye isn't similar if you're close, you don't need to.
I think we're just taking advantage of having you on the phone. We're just going to ask all our medical questions.
But I do have to say that the daycare that I've gone into so far, you've done a great job at that signage at the hand wash sinks. And I even saw one where the hand wash sink was a little higher, so they made steps to go to the hand wash sink. So good job in enforcing hand washing with the children.
Thank you. Michelle, were you saying that the outdoor had to be sanitized? The outdoor equipment, just soap and hot water isn't acceptable?
So you have two processes. The cleaning process, it removes dirt, debris, oils, anything that covers the surface. That's cleaning. Disinfecting actually is, in COVID case, it's called disinfection. Disinfecting is actually killing the virus. And that's why the EPA has a list called List N. Approximately, I think there's about almost 400 chemicals on there that can be used to kill the virus. And that's what you would use after
That in the question and answers, List N.
Okay, and hydrogen peroxide, is that okay?
Yes, that's one of the good ones.
Okay, I'm coming back to the sand question. Can they all be touching the same sand?
Oh, that's we get this a lot with cryptosporidium and parasites. Well, that one's a hard one because even if you use disinfectant, because the granules are millions, your chance of disinfecting the sandbox is very, very, very difficult. If you can, please try to not use a sandbox unless it's going to be one cohort, because disinfecting a sandbox is almost impossible. There is a CDC guidance on that I actually do have. I'll send that to you, but you'll see it's pretty tedious.
Ooh, okay. We're going to say, I think
Margaret.
Annette has a question.
Yes.
I do have a question. Thank you for asking me. So I have a school age program, and I feel like some of these things have been answered kind of in a roundabout way. It's very difficult in the school age because of the schedules that the school wants to put back in place. So they want to have Team A and Team B, Monday, Tuesday, Thursday, Friday. The kids will be in school for not even quite a full 3 hours each day. And then Wednesday, there's no school. It's all distance learning. So we now are faced with, how do we accommodate all of those children? Because we're going to have kids who go to school at 8:10 in the morning, and the other group of kids don't go till after lunchtime. And, typically in a school age program, we have kids come to us before they go to school, and then they leave and go to school. And then the other kids who have been in school come back to us. And I think what I'm hearing you say is that when they do go back to school, that's just something we're not going to be able to accommodate. But then Wednesday becomes the questions when there's no school and it's just total distance learning. We're all of us in my situation are kind of stuck on how to figure this out because, like, for example, I've gone from 150 kids a day to 32. And financially, like everybody else, it's just killing us. And we're trying to figure out how can we safely take care of everybody and meet everybody's needs at the same time. So do you have any suggestions that you can give us as far as how we are supposed to try to accommodate the shifting groups and the no school on Wednesdays?
So what I'll do, I'm going to write this question down because I would like to involve our schools. We have a separate schools team. So I'd like to involve our schools team in this question because it's a little bit more complicated. So from what I'm hearing from you is you have school on Monday, Tuesday, no school on Wednesday, then in-person school,
Yes.
Thursday, Friday. And then these children also go to childcare?
Yes, some of them will be.
Some will be, some will.
And I don't know, typically, like I was saying, we typically have 150 students a day. And right now I have 32. The ones that are here with us now have told me that when school does start up again in January, that they definitely want their students in school, but they want to be with us before school and after school. And then I have a whole list of families, about 75 to 80 families, who want to be coming, but don't want to be coming back into school. So there's a lot of shift work with the kids between accommodating those schedules.
Yeah, because you'll have whatever, what I'm understanding from what I hear from you is you'll have before and after school programs.
Right. So typically we would have the kids who go to school at the early shift, the AM shift. The PM kids would be with us in the morning before school. The AM kids are at school, and then they swap after lunch. They would want to swap and have the PM kids go to school, and then the AM kids come back to us.
Got it. Do you mind if I
after school, the late kids, they would want to be able to send them back to us, which I know that's how they do things in the normal world. But I know we're not normal right now. So that's a big concern for how do we try to accommodate that.
Okay. And what was your name?
My name is Annette Pasalia.
Okay. So what I'm going to do is I'm going to write this question out, and then I'm going to consult with our whole team together so that we can have a consistent answer and then reply back to Margaret to give to you. Is that okay with you?
That's fantastic.
Okay. Okay. Because I think this is going to take more thought.
Okay,
Thank
thank you.
Annette. That's just the type of complicated question that many of our programs have. They're really
Yes,
struggling
we're all
trying to
confused
interpret.
together.
Yes.
Thank
Yeah,
you.
and that's part of us working as a team. We have a locations team and a schools team. We can get together and help you solve as much as possible.
Thank you.
That's wonderful because our childcare community is kind of at the mercy of what's going on. Sometimes
Yes.
they have children from different school districts, from different schools. And so they're kind of, how do they coordinate?
Right.
It's very
Yeah.
difficult for them. So if you're talking with the schools, that would be very helpful to pass that on.
Yeah,
Okay.
definitely. And I'll talk to our
We
schools
need
lead.
we need to close up here because we could ask you questions from now till forever. But let me ask you some real fast questions about maybe Dr. McCurry, about the touchless thermometers. Their response is quite a wide range. Do you have much? How are you thinking that touchless thermometers are reliable? For their
I imagine it depends on the type and how the manufacturer and how it's being used. If it's being used appropriately, they definitely have a vast difference of temperatures, and they aren't necessarily. Some temporal ones are very, very, very good, and I don't know the exact ones that are those, but some may not be as good, and I think it just depends on the manufacturer. But they're a good indication. Especially as you've seen the trends, if there's any concerns in kids by using that. I've seen some places use them inappropriately, so make sure all staff are trained on how to actually appropriately use the temporal ones. And so,
okay. So she's saying that when she takes the temperature, it reads 99.4, and then you take it a few minutes later and it's 98.4.
yeah, so things can change slightly in turns because it is a temporal, so it may be an indication of your skin just being hot versus if someone came during the summer, particularly if someone came outside, if you waited a second and it changes, it's likely more appropriate if it's decreasing. And so there can be variations. There can be variations even when you take temperatures in your mouth, as long as it's done appropriately. It's just more of an indication of if there's concerns at that time.
Okay.
And also with thermometers, if it's exposed and sitting in high heat or dropped many times, it can go out of accuracy. So you really have to be careful with those thermometers. And then what you can do is, if you want to make sure for accuracy, I can send you something for what's called calibration to make sure that thermometer is at least somewhat accurate. And so, but after a while, these thermometers that they're coming out with are really well, but again, you have to really avoid trying to drop them.
We've had a couple questions about the face masks. So right now with the runny noses and the children, how sanitary are the face masks, or the over the mouth with the children runny noses? It's still better to wear the the face mask. We've just had some problems with that. Somebody's just saying, sometimes they're sneezing and spitting inside the face mask or the shield. Are you recommending teachers wear a shield and a face mask? Does the shield add any extra security for them?
Shield, go ahead.
The shield does add extra protection, particularly potentially if people have a lot of secretions or have very close contact with individuals. I think in some instances we have potentially recommended shields for different type of workers, particularly for healthcare settings and healthcare workers who we do recommend wearing shields because they're doing close clinical care within 6 feet of individuals. And so shields could potentially add an extra layer of protection, but there isn't any general recommendations for that in childcare settings currently.
Okay, thank you. What about if you have a cohort of your 8 children or your 12 children? It's the same ones using that classroom of toys. Do you need to wash down those toys every day if it's the same 8 children coming back playing with them the next day?
Yes, because you don't know whether that one day one child was there that has been exposed.
Okay, good point. Thank you. I don't know if you're the right people to ask about when they want us to have the children separate. Does the wall need to go all the way up for separation? Can you have dividers in your room?
That's a good one. I just read something on that. Reagan or Sophie, I just read something on that. I'll verify and then I'll send that to you. But for right now, Reagan or Sophie, do you have any data on that?
I don't have any data per se, but I would say just knowing if there's any concern for potential airborne as we're learning more, that just a barrier that doesn't kind of enclose the space up to the wall wouldn't necessarily decrease the chance of like airborne, but it is still some kind of protection in terms of how things move through the air. But I haven't looked at any data in terms of that either, Michelle.
Yeah, for restaurants, some of them you'll notice that they're going to start putting barriers, and there is a measurement for that. I'll try to find that and send that to you. But as Sophie mentioned, it's the amount of exposure. So luckily the kids are small, so your barriers probably maybe 6 feet or so.
Okay, thank you. So I'm going to try to wrap this up. I want to reassure all the people that are on this call that we will get you all the written information that Michelle and Dr. Mercuria and Reagan have shared with us, all the slides, all the resources. We will look at the questions. I know I was quite sporadic with reading the easier questions, and the tougher questions I will pass on to them and get back to you. If your name is by your question, we could maybe get back to you specifically. Some of the questions we kind of know and didn't ask them the questions because we've heard that answer before. So we will try to get back to the participants with some of these answers, okay? So Michelle, if we could still contact your team for questions between now and when we send out information to the participants, I'd appreciate that.
Absolutely.
I know things are changing all the time, so it makes it even tougher. But right now, it's just those darn runny noses that are driving everybody crazy.
That's the truth.
So, Kim, was there anybody else that was jumping up and down, raising their hand that needed to ask a quick question?
Just Emilde, she had a question really quick about childcare homes because she said that her son go back and forth between being in school and childcare. So if there is any recommendations.
Similar to Annette's question, I think, going from school to care to school. So that might answer, when we have that answer, that'll probably answer that question as well.
Okay. So what I'll do is I will put an email together once I get all of the resources, the information, and the recording. The webinar has been recorded, so we will try to upload it and share it with all of you. So I will try to put an email together with everything.
Okay, Michelle, I want to ask you one last question. The CDC decision tree says if there's a case, you should close the school 2 to 5 days. But in the scenario, you said 14 days closure for a positive case.
The quarantine. So are you there still there, Sophie? So again, depending on, we'll look at, for closure, we're going to look at how many cases, where is it, how many classrooms. So for us, it's the quarantine amount of time. They're talking, I think CDC was talking about isolation time. Sophie.
The CDC algorithm was saying 3 to 5 days to close so you can further understand what's happening and do a good contact investigation. They weren't taking in consideration quarantine of close contacts. And so places would need to close, particularly who is quarantined. So honestly, it's more likely that a cohort would be quarantined, and then that cohort has to quarantine, including the staff members if there's an exposure. And so if your facility had other cohorts that didn't have exposure or concerns in terms of your child care setting, you may not have to close down the whole setting. The others could potentially continue on, but the close contacts would need to be quarantined and then appropriate cleaning within the case's site. So the 3 to 5 days is really to understand what's happening within the child care setting or the school setting, and then potentially making decisions of isolation and quarantine for everyone else.
Okay, thank you so much. Everyone's writing into the box, thanking your team so much. Michelle, Sophie, and Reagan, thank you so much for just taking these questions. I know it feels like we're bombarding you with these questions, but they take them very seriously in childcare. So they must have the families feel safe, and they're trying to stay in business. So we're getting so many thank yous and so much appreciation from the participants.
And
So
we're here for you.
I'd like to keep your contact information and keep sending you more questions, okay?
Sure, we're a team.
Thank you so much. I thank everybody that's on the call. Thank you for working so hard, keeping our families safe. We very much appreciate it. And we'll let you know if there's going to be another meeting, another session to answer more questions, okay?
You got it. Thank you, Margaret.
Thank you so much.
Thank you,
Have a
everyone.
great week.
You too.
Thank you.
Thank you.